Hi, my name is Lily Madrid Cervantes, and I would like to start by thanking you for this opportunity to interview. So, for the first question, a long term project I had was when I was a junior in high school. I had helped my friend Alex create his first film for Movie Filming Club. I was a cast member as well as a director, editor. I worked most parts. I would say one of the biggest challenges that we had as leaders was making sure that everyone was doing their part in terms of cast members, editors, just to make sure that we would get the film done in a timely manner. I mean, despite the film taking around 3 months to be created, we were able to stay motivated by creating a small community of people who were all passionate about the film. I made some great friends along the way, friends I had never met before doing the film, and ultimately, at the end of the day, it was all to help my friend Alex create this film so that he could submit it for film school. And that was one of the biggest things that I took from that. So I would say those two things, making friends, staying on top of things, and seeing his happiness in the end, was something that kept me the most motivated. For the second question, times where my leadership is tested is when I have to train new coming COPE Health scholars on both separate floors that I currently work on. And the two aspects of my own leadership that are tested are my confidence and my empathy. To start, my confidence is where I have to make sure that I am absolutely confident in the knowledge and advice that I am providing for the new scholars in order to make sure that they understand fully what they're getting into, what they can handle, what they can do while working the floors, and to make sure that they are comfortable with working these floors. In terms of my empathy, I have to sit myself down and realize that I was once in their position having no idea how to work the floors, and the only thing I could rely on was the health scholar that I had shadowed before I started working the floors on my own. So it is important to stay confident in your teachings as a leader, as well as to remain empathetic for those you are leading, because at some point I was also in that position, and I just wish the absolute best for anyone who is starting the program, and I want to make sure that my teachings are beneficial to them and will help them be successful. Lastly, I believe I will make a great nurse because I consider myself a person that is easy to communicate with. Whenever someone just needs someone to talk to or to listen, I am always there, and if they need me to respond, I make sure that I respond with something that makes them feel comfortable and heard. I can use this in the patient care setting with my patients in order to create a trustworthy bond, as well as let them know that I am someone that they can rely on and come to when they are feeling hurt or sick. I would also consider myself an adaptive person. Every experience that I've had in terms of volunteering, working as a COPE Health scholar in the patient care setting, it has helped me get to this point of applying to nursing school, and I feel that that is something that should be carried throughout the rest of a nursing career in order to make sure that every experience helps you learn something. That is something that I consider important to make me a great nurse. Lastly, from talking with past nurses, current nurses, nurse that I shadow, nurses that I work with, I believe that nursing will be the most fulfilling career because of the experience with patients and the overall goal of just making sure that each patient is treated and making a difference in someone's life.